Angels, this is Sam and Lizzie. Today we are going to be talking about the discussions you should have with your patient prior to doing their treatments.
Here we are, back in the room again.
Yes, hello angels, how are you? So today, this patient, which is very cute, she's so cute, I'm talking to her about where she wants hair and where she does not want hair because I'm going to be doing a dermaplane on her. And for some women, there's very specific requests and very specific wants and needs on the hair in the area beside the ear. What do we call them? Sideburns?
Sideburns.
So some people want them a certain way. They want them gone, they want them there, they want them a little bit, they want them
shaped.
Yeah. So it's important, especially for a first-time patient, somebody you've never treated before. It's important that you have that conversation. And I had a mirror. She was telling me what she was looking for, what she wanted gone, what she didn't want gone. And it's just really, really important to have those conversations with your patients. Again, especially if it's a first-time patient for you. I also discuss brows with them too. I do not want them to be afraid that I'm going to totally reshape their brows with a dermaplane blade. So I always like to have that discussion just to, settle their nerves because they've never had it done. So another thing that is really important is how you treat skin of color. And she does have an African American background. So I have discussions with her on how her skin reacts to certain things. You ask them, when you break out or have a pimple, do you have a dark spot that stays for a few days, few weeks? And that kind of helps gear your conversation. You want to be a little more gentle with that skin type. You don't want to be overly aggressive because you do not want to activate that overproduction of pigment. You don't want any post-inflammatory pigment. So always keep that in mind. Less is more with skin of color sometimes.
I love watching these dermaplanes.
She had a really good dermaplane.
It is. Look at that.
I think another good subject as well is positioning while doing a dermaplane on a patient. And I'm not just talking about the blade, but I'm talking about you. Like, where are you? Where is your face? Is your face right on top of theirs? Are you breathing into their nose? Nobody wants that. So
no,
it's really
not comfortable.
yeah. It's really important that you maintain that distance. You don't want them feeling like you are on top of them. So instead of really trying to, zoom in by putting your face right up in theirs to see that peach fuzz that's left or that you need to get to, you need to be using your tools. Use your magnifying lamp, use loupes, magnifying glasses. Make sure that you're not, just on top of them.
If you're wearing a mask, put it over your nose.
Yeah, that's a good point. I like that.
Because if you're not wearing that over your nose, they feel you breathing.
Yeah.
They smell your lunch.
Yeah.
And that's that's just not fun.
No, I think
not relaxing.
Yeah, I think we've kind of all had that happen too.
Yes.
So
we've all been there.
Yeah. Doing some extractions on her. I do like using these types of, they don't really call them Q-tips, but I will call them that for the sake of the video. But for using these types of Q-tips, it's a little gentler, again, on skin of color so that I am reducing the risk of post-inflammatory pigment when I'm doing extractions. I do not use metal tools anymore for that.
No, oh my gosh, no.
That's a thing of the past.
Her brows. Oof.
I know, she got pretty brows. Oh, that's always a sensitive spot when you're doing an extraction on the lips. She was such a trooper for letting me do that. It was a good extraction too. And she said she just tends to get those. She was telling me that her family is just prone to that. It's like something, she's like, it's definitely hereditary. But she was nice enough to let me go after that and film it, so.
And here we are with the sideburn. I bet she's freaking a little bit inside. She's very particular about that certain area, so I think that's why we decided this was a great topic to talk about, making sure your patients understand where you're going with the blade, what your plan is, so they're not sitting there silently freaking out inside.
Yeah, have that discussion with them before you get started so that they feel confident that you understand what they want
and
you're and you're executing that.
Yes.
So,
and not just giving them a haircut.
yeah. I've actually had a patient tell me that her hairdresser told her never get a dermaplane because they change your hairline. And I'm sure that hairdresser had seen some things.
We don't do that here.
But we're just going after the peach fuzz. And where the peach fuzz stops, we stop.
Mm-hmm.
We're not changing your hairline. That's not supposed to be happening. You're not supposed to be going over thick and coarse hair with a dermaplane blade.
Oh my gosh, no.
It's just really important to hold that skin tight also and spread that skin. I see a lot of different techniques, but the techniques where they're not really holding the skin tight and spreading the skin, you can, it's just dangerous. Don't do that. You want to hold it as tight as you can. And if you want to, I learned this from some of my permanent makeup artist friends, put a third finger down, and that really helps you stretch that skin out really well.
And look at the difference in her color. You can see the line on her cheek, how bright that is compared to up by her eyes.
Yeah.
It's already brightening her up.
You can see where I have dermaplanes. It's obvious where I've been already, because like she was saying, there's a difference in the color of the skin. And the other thing is, not everyone's peach fuzz is peach.
No.
Mine isn't. So when we take off these layers of dead skin cells and darker peach fuzz off of skin of color, it's just amazing, the brightening and the evening of that skin tone that you see, and it's addicting.
It's very addicting. Look at you go after those.
I know, she was like, yes,
Get
them out.
Get him.
She let me do it, so I went ahead and did it. And these weren't very big. The one on the lip was a lot more than any of the other ones that I got, but you definitely could feel them.
Mm-hmm.
And that's another thing, is I'm feeling the skin as I'm doing the extractions.
And this patient, again, she's very particular about her eyebrows. So making sure that your patient understands where you're going and you're not going to be chopping off their brows is super important.
Yeah.
Because that blade does feel like you're taking off your eyebrows sometimes.
Yeah, and I do have that discussion with them, usually prior. If I forget, as I'm working in the area, I do say that. Oh, and by the way, I'm not changing the shape of your eyebrows. I'm just kind of cleaning them up by taking off the peach fuzz. And before I do in between their brows, I actually put my fingers there and I say, is it okay if I do this area for you? Mm-hmm. And they will tell me yes or no.
That's super important.
Yeah, I've actually never had anybody say no. But I think it's nice to ask. I think they appreciate that.
You want to know that you know where you're going with the blade.
Yeah.
I think that's fair. And what do you think about, I've been watching some YouTube videos and Instagram. I get sent videos all the time. I'm sure you do too.
Yeah.
About that technique where their blade is so, like, it's not choppy. It's like strokes.
Like one big long stroke.
Yes. What's happening with that technique?
I don't know that you're I don't know that I could be that effective doing that type of technique. And I also don't want to be aggressive on the skin, so I would not personally do something like that. I want shorter, slower, effective strokes. And if you're just doing one stroke from the chin all the way up to the ear,
oh my gosh,
in one go, number one, that sounds scary.
For the patient, for sure.
You have a scalpel in your hand. That is what this is. Doctors perform surgery with this device, with this blade. So short and sweet little strokes is what I like, because I feel like I can be more effective and gentle at the same time.
That's perfect. Well, we're going to finish up here. Thank you again for, tuning into our YouTube channel and watching our Dermaplane by Sam. If you have any questions, make sure you leave them below like you normally do. We love that. And subscribe to our channel, please. We really appreciate it. Hit that bell so you know when we have uploaded a new one. Thank you, guys.
Bye-bye.
Bye.